Hello everyone and welcome back to the Heart Guardian podcast for Healthy Heart. I'm your host Dr. Aman Kapoor and we are going to focus today on an important topic for our health, the measurement of blood pressure. We all have heard about blood pressure, especially high blood pressure affecting almost every second or third person that we know. But we don't really understand what it means and how measuring it correctly can make a big difference in our lives. To help us understand more about this, we have with us eminent cardiologist and expert Dr. Jagdish Hiremath with us. Hiremath sir, welcome back to this episode. Please guide us about what blood pressure is it, why is it so important to measure it accurately. Over to you, sir.
Measurement of blood pressure. We know blood pressure, or BP as it is commonly known, is measured on the arm, right or the left. And we have a BP cuff, we have a machine by which we measure the blood pressure. But let's first know what is blood pressure. When the heart pumps out, about 70 ml of blood is pushed into the main artery or the aorta. This wave of blood gets propagated into the entire arterial system. This wave moves right up to the smaller arteries and capillaries. The pressure generated by this blood wave is known as the blood pressure or the BP. The top of the wave is the systolic blood pressure and the base is the diastolic blood pressure. If one pokes a needle or a tube in an artery, it measures about 120 millimeters of mercury and 80 millimeters of mercury at the base. Some centuries ago, it was discovered by a scientist who inserted a glass tube in a horse's neck artery and measured how much column of mercury was raised by the pressure. Now, of course, we have sophisticated non-invasive methods to record blood pressure. All human organs are designed to function at their best at a blood pressure of 120 by 80 millimeters of mercury. High or low blood pressure can result into organ dysfunction. Hence, all of us need to have a normal blood pressure, which is 120 by 80 millimeters, with slight variations if at all. In our entire adult life, average of 120 by 80 is ideal, with or without medication, salt restriction and weight loss. Various conditions like the common essential hypertension, obesity, snoring, excitement, drugs, stimulants, all can increase the blood pressure. Whereas dehydration, diarrhea, blood loss, vomiting, overdose of medication can reduce blood pressure. On either end, there are difficulties, hence measurement of blood pressure in health, in disease, on a regular basis, in sleep, during symptoms like headache and dizziness. It's all a very vital piece of information. Modern times demand we measure our own blood pressure frequently in a scientific manner and provide our treating doctor a piece of information to work on. The blood pressure measuring instrument, the BP apparatus, used to be made of mercury. Then came a clock dial-like araconide oscillator. The modern day BP apparatus is electronic. World over, mercury manometer is given up or banned due to health hazards of mercury. So as of today, we must know how to use electronic blood pressure apparatus to its best utility. A standard electronic apparatus is good enough. Its validity can be confirmed or one can cross-tally with a doctor's instrument. BP is measured in a sitting position. Sit on a chair with backrest in front of your table. Height of the table and the chair should be such that one's arm, tabletop, machine and the heart are at the same horizontal level. Place your feet on the ground without crossing them, separated. Rest your back on the backrest of the chair. Any one of the two arms can be used. The bladder or the cuff of the apparatus needs to be placed on a bare arm without a cloth. It should be firmly encircled, not loose nor tight. The rubber tubing should be slightly towards the little finger, away from the central line. When all this is achieved, the machine is switched on. When it is switched on, it will start measuring the blood pressure by inflating the cuff. In the ideal world, 3 readings should be obtained and averaged to decide the actual numbers. As a practical tip, sit in the correct position with the cuff tied to the arm. Do nothing for 60 seconds. And after 60 seconds, switch the machine on. This single reading could be close to the best average readings. One gets 3 numbers: systolic blood pressure SBP, diastolic blood pressure DBP, and the pulse rate. Note all 3 or take photograph of the monitor. The measurements that are noted can be presented to your doctor next time or entered in your health file. This is vital piece of information. For most normal people, measuring a blood pressure once in a month is good enough. For individuals who are on blood pressure medication or hypertensives, should be measuring their blood pressure every week, and if there are symptoms like dizziness, headache or otherwise. The timing of the blood pressure measurement also makes the difference on the quality of information. The blood pressure should be measured when one is at least 30 minutes away from a meal, a smoke, excitement, a cup of tea, sex, or any such activity which normally will increase the blood pressure temporarily. One can find out the best period of one's own lifestyle when such a period can be obtained, and the blood pressure should be recorded then. It should become a routine activity. When one goes to a doctor, the measurement technique might be different, but actually all doctors are all supposed to be recording the blood pressure in this manner. Space constraint and time constraints leads them to record blood pressure in lying down. Measurement done in a doctor's place, clinic or a hospital is known as office blood pressure. One done at home is known as home blood pressure. There is one more entity called the ambulatory blood pressure monitoring, or the ABPM. This is a special instrument which records the blood pressure of an individual at least 50 times in 24 hours. The cuff is tied and the instrument is given to the patient at home. The patient remains and continues his day-to-day activities like going to office, going for a walk. Blood pressure measurements are done periodically, even during sleep. The ABPM is a wonderful addition to the measurement of blood pressure, especially when it comes to research and studying effects of various medication. There are individuals who complain of dizziness and headache and palpitation at night, and in order to decipher the symptoms, whether they are related to high blood pressure, ABPM becomes an important tool. ABPM also gives you nighttime average, daytime average, and early morning surge of blood pressure. Ideally, the blood pressure should be controlled below 135 millimeters of mercury, systolic, all the times for all the individuals. But variations and fluctuations can be picked up in an ABPM study. Home monitoring of blood pressure is not able to record blood pressure during sleep, and that is where ABPM scores over the home BP monitoring. The average difference between the daytime and nighttime blood pressure is about 15 to 20%, and this is known as dipping of blood pressure during night. For those who are non-dippers, that means the difference is less than 15%, they are the ones who require regular medication to achieve that effect. The scientific information obtained from home BP and ambulatory blood pressure monitoring is immense, and this piece of information can lead to better management of blood pressure. Majority of official hypertension management Asian bodies look at quality and quantity of control of blood pressure. Quantity means the blood pressure needs to be below 135 millimeters of mercury most of the times, and also it should be covering 24-hour period. The 2-hour surge which takes place after waking up also needs to be controlled by perfect administration of medication. There are clinical conditions where the arteries in the upper limb are not filled, called the aortoarteritis, In this situation, the doctors make measurement on the leg, which is outside the purview of this podcast. So, my dear listeners, you now have a fair idea about measurement of blood pressure, an important clinical observation where you can help yourself and the treating doctor in managing your disease better. BP apparatus is one of the must home medical appliances of modern day living. Scientific way of measurement of blood pressure, correct frequency of measurement, good documentation will always help you and your doctor to manage yourself better from an entity which is very easy to control but still remains a menace for the society. So let's learn, imbibe this knowledge well, convert it into wisdom, and keep measuring blood pressure scientifically over a period of time.
Thank you so much, sir, for giving us really crisp and clear understanding of blood pressure measurement. Friends, remember the wisdom that has been given to you by Dr. Jagdish Hiremath, sir. Keep measuring your blood pressure scientifically and over a period of time. Remember, doing this can help you prevent a lot of heart problems in the future. My dear friends, this knowledge is vital not just for your own ears, but for everybody that you know, love, or care about. So share it with everyone that you know, love, and care so that more and more people can gain the right knowledge and take care of their hearts well and stay safe from high blood pressure. Till the next time, I'm your host and friend Dr. Aman Kapoor signing over and out with a request to you to follow this podcast, comment onto it, and stay healthy and fit and fine till the next episode. Bye-bye.